Good evening, viewers. We are blessed to be with a guest this evening, the Honorable NAMUGGA GORRETH, the Member of Parliament, MAWOGOLA County. She is the Shadow Minister for Science, Innovation and Technology. In this POLICON program, we discuss pertinent issues that are intending to steer the economic growth of this country and to make better the livelihoods of the people. We are blessed to be with you, Honorable. You may greet our viewers. They are very happy to be with you, especially on Smart 24 television. You're welcome. Thank you so much.
Thanks for really being tuned in to Smart TV 24, Smart 24. This is my first time to be on this station. I'm so grateful and impressed to be part of your guest today. Hope we shall have a lot to discuss as our viewers listening. Thank you.
Yes, Honorable, it is a pleasure to be with you, and it is true it's your first time, yet we are extremely honored and very happy to be with you as you speak to the Ugandans. One of the reasons why we take the pride of inviting the honorable members of parliament through this channel to share information is also in agreement with what of recent the speaker, the new elected speaker of the Parliament of Uganda stated that you want to bring the parliament to the people. Sure. And I want to assure you this is also one of the ways of bringing the parliament to the people by sharing information with them, teaching them, and above all, having the liberation that gives me hope that Uganda is still a better country to stay in. This evening, tonight, we will look at the state of health and the environment sector performance in the country of Uganda. And one may ask a question, does the current state of national health and environment sector performance have effect on the economic livelihoods of the people? We will be looking at a number of events, what has happened, and basically to have an analytical point of view. For some years ago, now since independence, which we refer as post-colonial era, post-independence era, Uganda has had a number of remarkable transformational changes, and that goes to agriculture, that goes to the national economic well-being, but our focus is on health. To humbly give you a preamble of our discussion and the viewers, we come with this topic for discussion because we value the health of the people. It is one of the ways that can lead to the creation of wealth. We cannot create wealth if we don't have good health. And together with us tonight, dear viewers, as we will go through our deliberation alongside with the guest, the Honorable Member of Parliament, MAWOGOLA County, that is Honorable NAMUGGA GORRETH, will also be concerned on what has been referred as statistics in our country by 2019, still remarkably known that 19 women die every day in our country when they are going to give birth. We also have many other areas of concern, especially in a moment of crisis. We've had the COVID crisis, the COVID-19 crisis, which by God's grace we've been able to be saved. And some died. Of course, up to today, we try our best to see how we can overcome all that. And again, citizens are concerned, as I was making a research, that the policy of Uganda health sector does not favor the poor. Those who may survive amid this difficult situation in terms of seeking for medical attention, they end up going abroad to seek for medical care. Some they go to South Africa, other they go to Kenya, other they go to India, other they go to America. And of recent was one of your strongest prayer while we were mourning the late Right Honorable Jacob Olanya, how best we can improve our state of the health sector. In the second round, we'll be looking also at the environment, because the environment has an effect, a correlational effect on the economic lives of the people. Honorable, you are welcome. It's a pleasure to receive you once again. Please, you have all the liberty and the freedom to share your fellow countrymen and women.
Thank you, Doctor, for having brought this kind of topic, and it will be my pleasure to really share my views and as we give an insight into the health situation of this country. I'm privileged to be part of the budget committee of this country. This is my first time in Parliament, but I've been a public servant for the last 15 years, not specifically in the line of health, but I've been serving a local government, meaning at least I can know what happens on ground, and I can at least have a shared view of what happens nationally. You know, normally when we talk about decentralization of economy and services of government, it cuts across medical, it cuts across all other services. The fact that we are centering on health, I will inform Ugandans that I think as a government, you know, people normally say, no, government has no money. You know, there is cost of resources. Whenever a service is not given, it is directly attached to money. But we want to ask, has government prioritized health in this country? First of all, when we talk about health, we don't first look at advanced, look at the basic services. As a citizen of Uganda, what is the role of government to a common person? For example, if you went to MAWOGOLA, my constituency of Matete, how many health centers do we have? And at which level? Currently in the country, we wouldn't have been having health center tools. Wouldn't have been having them. But I will inform you, government intends to upgrade all health center tools to health center 3s. And the challenge they are facing now is they have no land ownership. Government tells you are ready to give services, health, but there is no land. Now you will ask yourself, why has it been a practice in most local governments to sell off land? Because normally the reason as to why government used to own land is to give space for provision of government services. The reason as to why I have started from that far is because we are talking about health, but there are those areas that are supposed to have health facilities and they don't have them because government has no land for construction. And local governments have no money to buy land. Remember, Uganda is a country that, as of now, we have 146 districts. Some of those cannot even afford to collect revenue to cater for the basics that they can do as a local government. Now here they've acquired a district and they have to give the basic services. For example, you must buy land for government to give you a health facility. So we start, basically, there are those districts without health centers. There are those that still have health center tools. For example, if you can go to Zimbabwe as a district. Zimbabwe, yes. Zimbabwe has only a health center for.
We don't have a hospital?
We don't have. Zimbabwe has no hospital.
That's a district which had the minister, Honorable Sam Kutesa?
Yes.
You don't have
a
district hospital?
Not.
Oh, sorry.
Actually, as of now, we use the services of Masaka Regional Referral Hospital. But to move a patient from my constituency to Masaka Regional Referral Hospital, it is a distance of close to 50 kilometers of a Maram road. So and when it comes to sub-counties, I still have health center tools. I'm still grappling with the elevation. The Honorable Minister, State Minister Hajat Hanif and the Permanent Secretary Dana Trine, when they came to MAWOGOLA, they said, you know, we may not upgrade some of this because land ownership, government cannot invest on, you know, much as you have.
We are going together, Honorable. Do you have health center in your constituency or Center 3?
No, I don't have.
What about Center 3?
Health Center 3, I have one. But it serves a population of above 50,000 people.
Oh, that is serious.
And that is one, actually, that is Matete Town Council. Matete Town Council serves part of Hajat Hanifa's constituency, that is Rebitakuli, and it serves the whole MAWOGOLA County. A Health Center 3, seated on a few, actually it is just 2 acres. So as a country, much as we say government has no money, but have we prioritized health? You are talking about sensitization. But first go back to the basics. If you go to those, actually, let us accept we have health center 2s and 3s. Do we have the medicines that are required there? Do we have the personnel? Do we have the nurses in those health centers? Actually, people complain. You go to a health center, they will tell you to buy a book. After buying a book to prescribe what you are supposed to, the medicines that you are supposed to get, they will tell you go to the nearest pharmacy and buy. But come to rural areas. How many rural areas have pharmacies? I think you had previously when it was a ban by the Ministry of Health, and I think was it first by a presidential directive, that no one should own a pharmacy within Mulago Hospital, because it had become a practice for doctors to prescribe medicines
and they
or
buy,
drugs,
then they
and
say
people
they buy.
go to buy from their own pharmacies. So as a country, have we prioritized health? Because you ably said it. With a health population, you'll have a healthy generation, you'll have a healthy nation. Exactly. And this is a country where people have no water, you have no clean and safe water. Yes. What does it mean? You are prone to the basic diseases that require urgent medical attention. This is a country that, you know, when you look at population, go to these slums and see how they are densely populated. Meaning that much as we know that prevention is better than cure, but even the prevention has not been the sensitization part of it. When you hold medical camps, when do you inform people of when they are going to take place? And if you inform them, which media do you use? You will use a TV that is rarely watched. You will use sometimes the radio, yet you know that people normally have these local, you know, there are these local, in Uganda they call them ebizindalo, these local radios.
Local radios, yes.
With local radios, at least as you do the adverts, please make sure that you use the most appropriate media to cover the poor that you intend to serve. So when it comes to the area of health, first of all, we have issues of drugs in health centers at whichever level. We have issues of understaffing. But I mean, I was so disappointed when I went to the district and they told me that the wage bill gives a provision of, I don't remember the number, but I mean, it wasn't fully filled. They have a wage bill, but there are those posts that were still vacant. So as we complain, actually, when you statistically, we had the Honorable Jane Ruth Acheng gave a health report. I think it was last year, towards the end of towards the beginning of the second quarter. And she said there are those many districts that have not filled up the positions that they are meant to have within the medical area, within the area of health. Some positions are still vacant. But much as they are still vacant, what measures have you put in place to ensure that they are filled? You saw doctors strike, issues of salary. Oh, yes, you have them. How are they paid? You are finding our doctors moving out to go and become cleaners. They are moving in European countries to go and work in shops, shop attendants. So we cannot afford losing that technical brain out of, you know, to just go and do casual labor.
Honorable, we are still moving on together. You are giving a proper analysis, indeed, of the situation on the ground. Chemuyita mu Luganda nti embeera eri ku muntu wa bulijjo wansi eyo. The situation that the common person is facing, and indeed that's why when I'm a member of parliament, and I believe that's why they elected you, so that you can always be their voice. And elsewhere, those who are following us, it's always important to speak the truth, what exactly is happening. We appreciate there has been a narrative by, indeed, the government concerning what they have been able to do, especially in regard to construction of health center 4s, and especially also establishing formidable infrastructure systems, much as indeed it is still a gap, they are still wanting. But as you've stated it, according to what the viewers are expecting to hear from you as we go on step by step, is one of the hope that they are having in you, I presume, I'm not reading their mind, that you are part of their budget committee. But currently, number one, the operational, you are talking of health operational factor, what is happening on the ground. But there is a policy factor which you had hinted on, the primary health care. Before you came to Parliament, just for purpose of our discussion, to reach our discussion, there was a policy which was aiming to have to bring on board all people to have equality in accessibility of health services, leading to universal health insurance. On that point, primary health care versus universal health insurance, what do you think maybe in your recommendation or in your discussion could work better? We are talking about the state of our health in the country and which health should be equitable accessibility of health services, which is still a challenge. Which way to go and what has caused this delay?
Actually, I should mention that COVID-19 and its impact cannot be underestimated when it comes to policy and planning for this country. We shall accept that for the next 3 good financial years, we are going to find hiccups in as far as economy is concerned and the flow of incomes within the country. I told you I'm part of the budget committee. Recently, we had an engagement with URA, and they considered that we are in what we call an economic slavery as a country. Economic slavery. What does it mean? The income of the country is too little to sustain its intended, how should I term it? The income is too little to sustain our budget. You are very much aware that the debt burden of this country has increased. What does it mean? Yes, we are looking forward to having universal health insurance. But as a country, before, it is very hard to plan for areas where you cannot as a country sustain. I have told you, it is so hard for this government to see government hospitals and other health centers have frequent supply of drugs. Drugs currently, supply is a challenge. I told you government intended to upgrade all health center 2s to 3s, to have at least 2 hospitals in most of the districts. Some of those are not going to be done because government has no money. And we had unfunded projects, all programs, from the budget framework paper that was presented for the financial year 2022-23. We had, I may give you an example. Ministry of Health wanted 397 million to increase the salaries of medical workers. Government provided only 3 billion. You had a shortfall of 394 million. The overall estimate, according to the submissions of the ministries, we are supposed to have a budget of close to 55 trillion. We only have 45 as of now. Yes, it is very important to have an health insurance for every Ugandan, because that is the way to go. You'll ask yourself, why, for example, as a member of parliament, why are you insured? For a member of parliament, I'm covered insurance-wise. Medical, I just take my children to the hospital. Then what package do you have for a common person? Every Ugandan would opt for that. We would love that, but implementation. And with the funny part of Ugandans, if something is mentioned that as government covers your health, contribute something little. People will say, it is government to give 100%. Most of our taxpayers, the informal, I'll talk about taxes because it feeds into the universal insurance, health insurance. The informal sector forms 51%. Informal, yes. But their contribution to the GDP is very minimal. What does it mean? And the people we want to insure mostly is the informal. Because most of those in the formal sector are already insured by their own
they pay
companies.
tax. When you buy this bottle of water, you are paid the tax.
That is deliberately, directly, they pay tax. That is why we are saying as a government, what should we look at? When you come to health insurance, this is money. We're going to insure people. How do they contribute to this? We are going to discuss the policy, yes. How should we ensure that people contribute to this health, to this universal health insurance? 2, as they do a contribution, how will government ensure that at least their incomes, because your poverty level is still very high, to the extent that you still have 40 to 45% of your population, of those that cannot even spend $1 per day. So you will have to get a deduction from them so that you can have their health covered. It is not going to be a policy. The way you see your NSSF being, money being deducted from you for NSSF. So this is what the health insurance coverage will be. You'll have to contribute as a Ugandan. You'll not say that because you are paying taxes, that is the direction that government should insure its citizens 100%. It cannot afford.
It should be with a certain percentage.
Yes.
But there's a question as you've reached on that point of discussion, and I pray that maybe it will be solved. This question will have the answer. Citizens are asking that if we are having the parliament that is for people, why can't they disband? Why can't they be against? Because this is a matter of policy. Allocating public resources for those who are ministers and MPs, when they get sick, they are just airlifted to America. Others, they are airlifted to India. And then the common person is saying, if they know that they are fighting for the people, why can't they work on these powerful hospitals? And then the issue of going to America, of going to South Africa, for those whom I said they are in a big position, comes to the end. The question which is behind that argument is that Uganda currently is spending much on public, VIPs, public officers, a lot of money. We are not going into all details as we are already aware. Some, I remember one who was a presidential advisor that I will found with that, and it is an example. Nagenda was going for a heart operation in India, in USA. On one person was going to spend 300 million just for a short while. So one asks that if that policy is disbanded, where we are saying that we don't have money, if that policy was disbanded of only putting in much more money to the VIP public officers, and that's why the complaint is that it looks to be good health is only for the rich and those who are in good positions, and then the poor survival is for the fittest. What is your take on that?
Actually, I cannot admit that good health is only to the rich. For a common Ugandan, as representatives of the people, as MPs, we've been complaining. You heard even during the time of apologizing the death of the Honorable Jacob Olanya when we were paying tribute in Parliament. I'm the one who rose up to talk about extravagancy in expenditure of government resources. I spoke about it. I told you it's not that we don't have the money, but how do we allocate? Before even insuring Ugandans, before even come up with an insurance policy, do we have basic health services for a common Ugandan? You heard the Honorable Matthias Mpuga in his statement about the Lower Hospital money. They allocated money for Lower Hospital as a specialized hospital to serve at least for extraordinary diseases. But what is in Lubowa as of now? Nothing. What happened to the person that ate the money for Lubowa? Nothing. We are waiting for investigations. Nothing. That's why we said now it is the time for Parliament to call out its oversight role. Because, look at Mulago Hospital. Do you think Mulago is for the common person? Go to Mulago and see whether you can get what we call basic health care. Basic. I want to see somebody go to Mulago, be treated without any payment. Because that is what they call, health services by government. When it is very rare for a common Ugandan, look at these hospitals, Kawempe. Look at, actually, before even you go to Kawempe, go back to Mulago itself. Now part of it is private, the other part is for the local people. But I want to ask, if the local person went to Mulago, the section of those that is called for that was allocated to the local person, if you get there, will you be admitted? Will you get treatment from a specialized doctor for free? Will you get medication? will you get all the drugs that are relevant for, at least, I'm not talking about for, extraordinary diseases, but at least let's say a person is going to give birth. Can you be operated for free? People pay doctors in Mulago.
They pay.
Women pay. Yes, they say this. Much as it is said that, it's free medical service. Even come to Masaka Regional Referral Hospital where our people go.
You have reached on a very good point where you referred as the oversight law. The Parliament will wish to employ so that we can have a bridging of the gap. That is a good promise. By the oversight law of the Parliament, the citizens are still asking. You know, today I'm on the side much more of what I've gathered from the people. They are asking, why can the Parliament begin to come up with actionable points that will not allow a number of these challenges to remain? Corruption, as you've mentioned, I will mention it, is part of the challenge. Corruption of who gets the medical care and who doesn't get the medical care is the order of the day. The medicine which you've talked about, it is believed, according to even the reports from the government, it seems to be that some of the medicine is being stolen. At times, some desks have been created and put in place so that they can be able to check and fight this corruption of the sale of medicine and taken away by those who swindled away by those who are in charge. What will the Parliament may be planning, the actionable points that we will say enough is enough as we do execute or exercise our oversight role? This must happen. As I again welcome you to give in your input. Before you came into Parliament, at least you were aware of what was happening here. Time came when they were going to Ruvoa, the Ruvoa hospital we talked about, and MPs you looked outside, not even to come and visit. How are you going to be more assertive in exercising your oversight role?
As a country, Parliament cannot work alone. Remember, we have three arms. You have the executive, you have the judiciary, you have Parliament. Dear viewers, I would like to inform you that it is the executive that begins the whole planning process. It begins with the executive. They set priorities. Then they bring whatever they have screened and they feel that is the direction the country should take to Parliament. And all of you must be aware that as the opposition, our overall duty is to check mark government. Where are they doing well? What haven't they done? What should they do? But because of numbers, so many things, we can make several proposals, but they are not taken up. And you've talked about issues of corruption. You saw the the IGG, yes. Betty Kamya, yes. When she came up to talk about about beginning a lifestyle audit, a lifestyle audit to all those that seem to have what may not, genuinely belong to them. The president said, no, as long as they have invested in the country, it seemed to be okay. So do you think by that statement, Betty Kamya can do much?
Really, it can be.
And, Parliament does not enforce. Our role is to give reports for others to enforce. You've seen people being aligned before court, and the next day they are left to scot-free. Yet they have done, there is evidence, come to police, a lot of corruption, people are taken with evidence, but it all ends in a, so as you are talking about corruption, medicines, you are forgetting an issue of reluctance by the staff, medical staff themselves. You've seen drugs being banned. Why don't you ask yourself, why do we ban drugs? Yet people are saying we don't have drugs in hospitals. You've seen NMS, the reason that they gave last time when people were complaining about the banning of drugs. They said, but we give them what they ask for. You get to stores, when some drug is totally out of stock, the others are overstocked. Do we have professionals doing this kind of work? If they're not doing their work, who evaluates their performance? And does it mean that if you are employed to do a lot of nothing, you should keep there whether you are performing or not? So it all comes back to us. And let me inform viewers, government is going to spend 80 billion next financial year. 80 billion. 80 billion on mindset change and sensitization.
We are not at Patana with you, please.
Mindset change, and I'm not in support of that. Do you know why? It is because some of these things are done deliberately. You want to tell me that that person who sits in stores, who knows how to rotate stock, should also be taught how to change mind and the way of doing things? So, at the end of the day,
are you going to approve that budget?
Actually, I'm telling you, personally, and other colleagues in the opposition. Yes. We are not in support of,
so we'll wait for the minority report and...
definitely,
yes.
we shall.
Yes. Yes.
You cannot spend 80 billion
for mindset change.
For mindset change and sensitization. By the way, for your own information.
But don't you think it's important?
Let me give you information on something.
Yes, please.
Every station, whether TV or radio in this country, must give an hour to government to tell them what they're supposed to do. Yes. Tell me, how are they going to spend the money for mindset change? I've been in the budgeting process for government for quite some time. We always allocate money for communication. It's a line in the budget. How do they spend that money? So to me, this mindset change and these others, it's an avenue of stealing government money. We can see, if I've been on several stations, and they tell you when we invite these colleagues of yours in government to give an explanation of what government is doing, they don't turn up. Like
today, I invited you, and the good thing you turned up, and that's part of the mindset change.
So, yes, whatever we're talking about here can change the minds of the people. But the other thing I'm questioning is mindset change to a common person. What about the leaders? In next financial year's budget, Presidency, Office of the President asked for a recruitment of 135 presidential advisors. 135 presidential advisors.
135?
Yes, in addition to those that we have.
What would have been your recommendation of a right number of presidential advisors?
No,
because I understand where we are. I know the point you are drawing to. So that we can have, the reason why I'm bringing this to you, to us and the viewers, so that we can know possibly what would have been a reasonable number for a presidential advisor, so that the other money, which because a presidential advisor is expensive to maintain, so that the other money could at least be located to a certain center, including you as well. You don't have even space to buy land for construction center for.
Actually, I'm also going to set a question to you. You are asking the number of presidential advisors. Before we get to them, we have 146 districts.
146. Yes.
Each district has the office of the RDC. Who is the representative of the president in a district? Do you think the district should have a presidential advisor?
The district?
Yes.
Again?
You have an RDC and the deputies, a fully fledged office at a district to represent the president. Tell me, do you want to have an advisor there? And what is the RDC doing? So that is why I cannot give you an answer of how many advisors are required. Because by structure, we have those impliedly. The ones who would see as advisors. To me, an RDC is already an advisor. What do they do? So on top of the RDCs, because when they talked about 135, then I asked myself, and this is on top of the existing ones.
135 more.
On top of those.
More advisors.
Yes, more advisors. We are asking. That means each district should have an advisor on top of the RDC and other existing. You remember, by structure, you have the VISO, you have the PISO, you have the DISO, all those advise in lines of security. So really, before government embarks on issues of extravagance,
expenditures,
I'm telling you, somebody may not want to hear this, but you saw people complain about the budget of the funeral of the Right Honorable Jacob Oulanyah. It started with 2.5 million.
2.5. Finally, it dropped to 1.2.
It dropped to 1.2.
So there was a plan to have double.
If Ugandans had kept quiet, what would have happened? If they had kept quiet bluntly about what was happening, what would have happened? Does it mean that we just have to make, or is when something is happening, we first have to make noise, say that government can know that that is not proper? Now tell me, with all such actions, you want to change the minds of people. I'm telling you, it all begins with leadership.
Leadership, yes. Both the ruling and the opposition.
Are we ready to sacrifice as you cut that cake? Can you cut it with all the fairness it deserves? Let me tell you, Ugandans can happily take themselves to hospitals as long as they are comfortable that we admit that government does not have. But the funny part of it is, no medicines, no hospitals, doctors always complaining, and by the way, I tell you what, government has put a ban on recruitment in some sectors. That is one of the strategy of the Ministry of Finance. And I'm telling you, because of financial constraints, in the next financial year's budget, government has committed to ensure efficiency and effectiveness in government expenditure.
Good.
So there are those sectors, but don't say good. There are those sectors that are not going to no adverts, no employing, because government has no money. Now I'm asking, if government has no money, what will happen?
Because I thought that if they recruit, that we are going to have a better improvement. That's why I was now also responding that maybe that would be good.
No, you know, at times people look at employment as a way of, you know, employing people so that they can also put something to the economy. Yeah. But look at the constraint that it puts to the government, you know, that it puts at the whole, the government budget as a commitment. You are aware government is, we are merging. Government intends to merge. These are the institutions. You saw REA was merged. The Ministry of Science, Innovation and Technology is back. So government is trying to cut expenditure. But our question is, as you cut expenditure, where are you allocating this money? As you do cut here and there, where are you putting that money?
Honorable, thank you so much. We are still together, and so far, we appreciate for your insightful, you know, views, which are indeed revealing the state of health, and especially you talked about the funding gap, and which funding gap you are very much expressing displeasure because of the extravagant expenditures. But yet, because of being with you as a legislator and a policymaker, there are some of the actions, if at all they are possible, maybe you will tell us these are possible or these are not possible, why the change we admire all of us as countrymen and women is not coming out. One, those who are having the mandate, our members of parliament, as you are here, and others not pinning you specifically, you are being denied, I'm mentioning it again, even to play the oversight role of one of the specialized hospitals, that is the Rubowa project. And as a matter of fact, which is disappointing, they continue to say, wait, investigation is on. Wait, the investigation is on. The other day I was happy, I will say it, I was happy when you showed action. Especially it was a different matter on human rights abuse of some of our members, who are some of the members who are either detained in a manner that is either abusing their rights. And the population are waiting to see more actions. Because how can a hospital that commenced around 2013 up to date, and by the time when the story stopped, I remember by that time one of the members was part of the team, Honorable Andrew Wadayanga from Kabar and others, both NRM, they were all stopped by police, don't come to Meta here. What exactly should be done? Number one, that's number one. What can be done? Is it possible to change that status quo where your mandated power is being resisted by those who are not supposed to resist it, because police is not supposed to resist a member of parliament. Number two, as we talk about the wasteful and extravagant expenditures, when, or maybe what is in the store of the alternative government, as I have been able to understand, you come from, leaning to the opposition as a shadow minister, especially to ensure that we can end the wasteful expenditure on top government officials going to get medication from abroad. They spend on them billions, they spend on them 100 millions. You all come to give in your insight. And before you come in, there's something that happened in our region. I come from Kigezi. And there was a minister, a woman member of parliament, the daughter of the minister of the daughter of, that is Mateke. Honorable Minister Mateke, Kabale. And there was an MP who was going to get medication and went to Kabale Hospital. Could not be flown to search for medical assistance. She died there. Should we fast for such scenarios rather than fixing our health system? You are welcome again.
Now, as the alternative government, you know, we have an alternative legislative agenda on the side of the opposition. Normally, people used to think that legislation and setting an agenda is a preserve of government, but this time we came up with a legislative agenda as a way of really having our own direction, so that every time this mention about this, we shall be putting our alternatives on table. Though, whenever we bring them out, they are, you know, they are not considered. You asked an important question about your oversight, and when they resist, what do we do? The challenge that we have these days in politics or in leadership is about politicizing service delivery. you know, much as something bad has been done by government, NRM MPs would always want to cover up. Because it's government, how will people see, you know, see this being done under the leadership of the NRM? Yet we know that you cannot be on the straight path all the time. Work is done through committees of parliament. That is the committee. For example, when it comes to health, you have the committee of health. Its leadership, chairperson and vice, they are in the ruling government. When we went to Malawi, the beauty of it was, for them when it comes to committees, if you are elected a member of parliament and you are allocated to a committee, it is the committee members that sit and, you know, and nominate and elect within themselves a chairperson and a vice, depending on competence. So that means you'll find an opposition legislator, or NRM, if an NRM is the chairperson, you will find an opposition legislator, a vice, as long as they have the competence and capability. So what happens sometimes, much as you said we are denied the oversight role, but how do we bring this out in our reports? At times these happen, and when it comes to drafting of reports, these are not put. You'll see them on legislators being chased from Lubawa. But when it comes to writing a report, they will not indicate it. Because after being chased, they will be called somewhere, they will be summoned somewhere by the ruling, their president, you know, why did you allow this to happen? Why? So everyone will fear to sign on such a report. That's why some time back I asked from the budget committee, is a minority report a preserve of the opposition only? Can you tell us that at any point for you, whatever is being said, the other side is okay, whatever we are saying is out of context as the opposition? Have you ever seen an NRM legislator
What was the response? And,
you know, they shun away. Because this is what we want to say. Actually, we are not in parliament to just fight these common wars. No, it's not all about party, but we are seeing service. For example, you saw us in the budget framework paper when we are citing out issues of capital plight, issues of when government brought out risky projects, those that were worked on roads, being worked on in the middle, government says this wasn't a good investment. Over 2.8 trillion. Government is stuck, works can't go on, and they're saying we need to either renegotiate or cancel a contract.
do you have hope that Lubawa Hospital, which Ugandans are waiting for, will be the Lubawa question?
I'm telling you, the Lubawa question leaves a lot to be answered, because we are questioning who is accountable for what was released. Who is going to account for that? When it is mentioned, no one comes up to give an explanation. Honorable Mpuga said, as we were paying tribute to the Honorable late Right Honorable Speaker Jacob Olanya, he said it's not going to be business as usual. We've asked for this information legally, we've asked for it in a formal way, nothing is being given. So we are going to look for other means of questioning government and what it does. Because we have written as the opposition, we have written questioning how can you, how can you account for this? Nothing. The minister dodges it around, and actually even the NRM are up in arms this time around. We are very excited. They all said, that came out at a time when government wanted to borrow some other money. They said, no, you will not borrow any other money in the line of health because Lubawa Hospital money has not yet been accounted for. But don't you think you'll also cripple service delivery in other areas? Because government is not borrowing for Lubawa money now, right? For Lubawa Hospital. It is borrowing for something else. It comes back to appropriation. If we sit to cut the cake as parliament, where do we direct resources? Why should we, we were very disappointed as the budget committee, I should say this on air. The budget framework paper was brought, we gave our views, but they were not considered.
All of them?
Yes. The report came as was proposed by the Minister of Finance. Colleagues complained, now why are we there? If whatever the executive proposed is what should be considered as a final, as a final document, then why are we here? So I think the executive must respect the legislature when it comes to, when it comes to taking decision in as far as the direction of this country is concerned. Because, most of the times people may blame Parliament, but I'm telling you, it is a joint effort. Cabinet is, cabinet does most of the things that you do. And the NRM, our colleagues fear, or, they don't want to divert from what the big man, wishes to do. So when it comes to the issue of health, as legislators, we are very passionate. You know, because I also take my children to the same hospitals where I take yours. If Mulago has no, just imagine, do you think if my daughter falls sick and she's taken to hospital, the way you were saying an MP's child died?
For them, they may think that for them, they will fly also them
no,
abroad.
Let me ask, do you think if you fly, you immediately get medication? Do you know the process of flying and getting to an hospital? It may require urgent attention. You may lose life. So real, and let me tell you people, it is very painful to die abroad. It is very painful because everyone would wish to have your people check on you. You saw it when some of, the children of the Right Honorable Anya were talking about it. Everyone would have wished to die close to their people. You know, those movements, just imagine the distance from Uganda to Seattle. Don't you think even some of those inconveniences can let somebody die?
And another thing, Honorable, which we are looking at in our discussion is, number one, we intend to see the bridging of the funding gap that sector. But again, we are very much mindful that if the allocation or the disbandment of extravagant expenditure is done, then where we are talking about the poor populace, because remember, we are still having a 46% of Ugandans who are below poverty levels. And according to the good information you are sharing with us, we realize that the allocation of funds, number one, on public administration, where you mentioned the recruitment of many presidential advisors. And to the viewers, maybe something which you were to bring out is to know how much a presidential advisor is paid. But again, when we look at the number, they already reserved money for the number of ministers, around 89, around that number, who are already guaranteed by the budget that if either the wife, the child, or the husband gets sick or any medical challenge, it is easy just to be thrown out of the country, whether by airplane, whether by any means, but you can get medication. In higher, those expensive specialized hospital centers in abroad. So it remains with us as we look at whether you have brought it in your alternative. You've talked about the legislative agenda, whether in part of the reallocation of resources you brought this out, because we wonder whether you are still in supportive of that. Should it continue to happen, to have a policy that is only to guarantee the top government officials for medication, yet we still have a poor population, and including your district where you don't have your constituency, you don't have a center for. In your district, you don't have a hospital. I pray one of these days you'll call us and we'll go to cover that documentary of where Sembabule doesn't have a hospital. We will be able to offer this as material, and I will bring that information here. You're welcome again, please. We want to see how we can have a balance, because something needs to be done.
Actually, for something that we've started with in the alternative, next financial years, though government also picked it up, in the next financial year's budgets, there have been those recurring challenges. For example, the maternal mortality rate, mothers dying in labor, and government is going to put some good investment, at least to reduce the maternal mortality rate. And this has been also demanded by most NGOs and women advocate groups, and that has been at least catered for. And much as I said, there is no money, but government intends, at least for the existing health workers, government intends to improve on their motivation, because really they work hard and you cannot just imagine the little that is paid to them. So for those that it shall maintain, you saw the letter that was written by the Permanent Secretary, Diana Atwine, she cancelled contracts of those additional staff that were working during the COVID time, much as it wasn't appropriate, but I think because of financial constraints, that was done. Though it wasn't, they were not prepared to exit. They worked so hard during the 2 years of COVID with minimal pay, and you cannot just lay them off because you don't have money. Issue of ambulances, It is part of government program to ensure that at least every hospital and health center falls have ambulances.
Do you think it is ideal for MPs to be done spending on buying ambulances?
Actually, I personally, as a legislator, MPs do it because of corporate social responsibility. But that is not where we should be putting emphasis as MPs. We should we should put pressure on government to do what it is supposed to do. Because I'm telling you, how many of you can afford to buy? And you remember the statement that the Honorable Minister made. She told you those are not ambulances. What MPs are buying are just vans for showbiz. They are not ambulances. What they call an ambulance is not what the MPs buy.
But at that time they save souls.
No, we said whether vans or taxis, they have done something.
Yes.
Than
nothing.
No, I gave an example of Zimbabwe Health Center 4 that has no ambulance. It's the health center for the whole district. It has no ambulance. So we told the Honorable Minister, instead of criticizing what the MPs have given, please do your work, because if she had done, the MPs wouldn't have bought. That is not within the mandate of the MP to buy an ambulance. It's just because you feel the pain of people dying along the way, and you buy. So issues of maternal mortality rate, issues of ambulances, drugs in hospitals and health centers of government, though issues of stores is still a challenge. National Medical Stores complains there is a lot of wastage. Why do we ban drugs? Disposal through banning of drugs is already a cost to government, but still that is wastage of government resources. So as the opposition, we are going to really put in an effort to ensure that we checkmark government, to ensure that appropriation is done as a pro-people budget. But it comes back to all of us as Ugandans. Let us demand for services. We cannot do it alone. I told you, we give alternatives and they are put aside. The government will do what it feels it wants. So what is the role of the common people, Ugandans? What is your role in demanding these basic services from government? Should you keep quiet as you go to, you find mothers having given birth and they are laid down. They have no beds, So what can we do as the citizens of this country? How can you demand for services? I normally tell people that it is your freedom, it is constitutional to come on streets in big numbers to show your dissatisfaction.
But now do you think that is workable?
Why?
For the people to go on the streets, do they feel that when they go there they will get the services?
No, and when will you ever show your grievances? They bring petitions to Parliament. What happens? You bring a petition, what next? What does government do? I'm telling you, that is the constitutional, it is your constitutional right to show your dissatisfaction. We were in Malawi, and Malawi is a funny country where the opposition now was the party in government. And they said, here people came out and said enough is enough. We cannot take it anymore. We are not saying that we are fighting for power. Not. We want to have what they call basic services to a common Ugandan. When it comes to health, we cannot, this is too much and beyond. Just imagine how many of you can, and fun enough, Kenya, which hospital is that where we normally go? It is Aga Khan Hospital, Kenya. Aga Khan has become a hospital. Most Ugandans now, they are treated in Aga Khan. But the funny part of it is we are taking money. Yes. Money from Uganda to Aga Khan.
And also as well, our shillings to change to dollars to
inflation.
India to USA.
You are taking money out. We are talking about capital plight. Yeah? Government borrows money to come and construct roads here. Most of them are given to Chinese. When they make profits, they repatriate, take money to their own countries. So this comes back to health. Why do we spend a big portion of our own budget, the hardly earned money, to go and treat people from abroad?
Thank you. I've heard you. Thank you so much. And the viewers, I believe they are following, but there is a pertinent question or concern that we will also look at in some of your few or your expression of views before you go for a break. We realize that you have brought to us exactly giving us the insight on the policy making point of view and the implementation. But as you said it, that the Parliament, the legislature and the executive, they have a responsibility, a corporate responsibility, but at the same time, we must mark this, Honorable, that the citizens also have the responsibility. And at times, the NGO, they also have the responsibility of ensuring that we can have an improved health sector system, and which health sector system should be able to enable our people improve on the economic livelihoods. What do you think is the relationship to achieve that? Because the citizen, they are the other side. They are waiting, government, please provide us good health services. And the NGO, the civil society, they're also saying, please, we're also looking on new government. And yet, our basic target as smart television is to have, today, we are dealing with having a wealthier population. But we are saying that we need a partnership together in this fight for a wealthier population, which must be with good health. What do you think are defined boundaries of responsibilities by other stakeholders other than government?
It's what an interesting question. You know, when it comes to civil society, the citizens, parliament, executive, let's look at the citizens. You know, I ably said it, prevention is better than cure. Personal health, what have you done to ensure that you reduce the infections when it comes to malaria, when it comes to drinking boiled water, when it comes to what else to prevent these common food, when it comes to personal hygiene, because it all starts with you. By the way, as we know, whenever you put pressure on government, whenever you don't do your part, you'll put your pressure, all that, exert the pressure on government. Will government afford to hold all that burden, right from sensitizing on how you should feed, on why you should bathe, on how you should clean your water, on how you should, you know, how you should maintain proper hygiene. So it all comes back to personal responsibility. As a citizen of this country, have you taken what it takes to ensure that you have an healthy life? Because preventive is better than, you know, government will, much as we look forward to having those hospitals well stationed, well, you know, everything in hospital. What can we do to ensure that we minimize you going to hospital? Is going to hospital the solution? There are those that can be avoided. Let me give you an example. Sometime back, government used to give nets. Do you know what happened? When you go to villages, you will find people rearing chicken, I mean hens, you know. The net is put outside as a small house.
So you're coming out to the point, Honorable. Not that you are out of the point, you are out of the point, but you are in the point. So now, don't you think that even if not much money should be spent, but that whether the mindset change is important?
Actually, we are talking the same language. I told you, go to the budget of health from here. Go and review their budget and see whether there is no component of communication. Whether there is
public awareness.
If public awareness. If actually we are just bringing the component of mindset change and sensitization. Yes. Before, what have they been using that? How have they been communicating? Haven't you been seeing adverts? What do we do? Let's intensify. Let us intensify. Let's target the right population. Let us see how best this message can go to the common person. Last, attitude change. Within us, the citizens, you don't need to be taught on how to take basic care of yourself. Government, and let me tell you, the reason why I insist on not using the 80 billion, there is a lot it can do. Do you know how much you can use that money for? If we said that money to, if we allocated it to
even
construction.
If they just say that they give you 100 million, you buy land and you construct your health center for.
Health center for. Yes. So 80 billion is a lot of money to be, you know, just given out.
1 billion, at times we break it down much as everyone understands. But 1 billion means 1,000 million. Yes, sometimes people don't understand 1,000. From 100 to 1,000.
Attitude change. Sometime back, the president used to talk about patriotism. People must be taught patriotism. You know, you cannot teach somebody to love a country. That's why I bring it back to us. I tell you, once you behave well as a leader, people will always follow what you do. You know the reason as to why whenever you go to radio, tell people, you know, you should put nets, you should do what? Then they question, you tell us to put nets. Why do you use this for this? Yeah? So you as you bring a solution, somebody also asks a question in a solution. So it all comes back. People they no longer trust what we say. How do we bring back that trust as leaders? Do you think somebody does not know the importance of putting a net? Because there are areas where mosquitoes can make noise in the night. Real noise.
Thank you. Now, as we go for our break, there is what remains wanting in our country. We at times only think the pandemic occurrences like COVID, when they come, that's when we should be able to get maybe statistics of how many people have died today, how many people have died tomorrow. Yet, I believe it should have been a responsibility if we are to make assessment, pure assessment, for improvement of the lives of the people. The country, indeed even the Constitution stipulates it, the Public Health Act, through your guidance as legislators, we are appealing to you, through you, that there is something that is still lacking, especially for awareness even of our state, to know that today Ugandans, how many have died, how many maybe they have been killed of this disease. It was only when we had the COVID-19. As your host, and also on behalf of the viewers, we feel there is a responsibility being shied away by either those who are responsible. When and maybe do you think that this would have been important to understand the state of our wealth, of our health and our wealth by having statistics? You can give your comment, then we'll go for a break.
No, automatically, statistics drives everything, because it is very hard in in Uganda. We believe in what we've seen. Normally, it is very hard for people to be, normally to rely on, in America, this was done, in Rwanda, this is being done. It is very, very important to disseminate information. Though, at times I think it is deliberate to hide information. For example, we used to see boards in hospitals where they would record. You go to a ward every day, they will show you how many they have, how many have died, how many have been discharged. That would be information on board. And they will look for a way of disseminating, though the challenge, I think, is the mode. Normally, reports are given in booklets written. How can we simplify? To have simplicity in communication, such that a common person, a Ugandan who has never gone to school, can understand what you are talking about.
To know that today we had how many cancer patients in Uganda who have died. We have these how many cancer patients. Because we shouldn't, to us, honorable, as we express our concern, we shouldn't think that it's only COVID that people should get statistics. Dear viewers, as we go for the break, we will continue from there. But all of us are agreeing it is important always to have statistics, to know today or this month how many people have come out from the poverty, under poverty line. And maybe if the end of the month, we know how many people either are making it to life and how many people either have not made it to life. And it will always help us to have a progressive society.
But the most funny part of it,
yes,
Ugandans are not interested in such.
They are not interested.
No, you have such programs. People will shun away from listening to them. People like music, they like films, they like political shows on basic things. So Ugandans should start picking interest.
But they have to have information, because before you are killed of a cancer, you should know what brings cancer.
Definitely.
So that you don't cry when the trouble comes. Thank you. Stay with us on Smart 24. God bless you. See you in the next session.